of using the Nevi 4, which is a modified version of the Montana jack. The Nevi 4 is a sickle scaler. A sickle scaler has a pointed toe in cross-section, which is why it needs to be used supragingivally. With that being said, a sickle scaler is used for supragingival calculus, specifically heavy and tenacious supragingival calculus. Because the Nevi 4 is a sickle scaler, it has 2 cutting edges on each end, totaling in all to 4 cutting edges. The Nevi 4 is to be used for posterior teeth, particularly in proximal surfaces. The angulation of this instrument needs to be 80 to 90 degrees to the long axis of the tooth to be worked on. In order to determine the correct working end, place the instrument in the patient's mouth. The correct end should be parallel to the tooth. The wrong end will go across the tooth. This will soon be demonstrated by the clinician. The right-handed clinician determine the correct working end. Place the instrument in the patient's mouth. When using the correct end, the terminal shank should be parallel to the long axis of the tooth. The wrong end will go across the tooth. The patient's head should be upright or turned slightly away from the clinician. The chin should be facing down in order to adequately access the mandibular teeth. The mirror should be held in the clinician's non-dominant hand. In this case, it would be held in the left hand since the clinician is right-hand dominant. Position the mirror by turning the mirror handle until the mirror head is parallel to the patient's buccal mucosa. The back of the mirror head is against the buccal mucosa, and the mirror's reflecting surface is facing towards the facial surfaces of the teeth. The instrument will be held in a modified pen grasp with the handle resting in the V of her hand. As you can see, the clinician has determined the correct working end and has placed it correctly in the mouth. Now she will perform the correct instrumentation technique. She will begin by placing the fulcrum 2 teeth away from the tooth that is being worked on. If you notice, her fulcrum is upright to give her a more accurate adaptation. She will begin with the surfaces towards her, and she will place the instrument on the distal facial line angle. She will then go distally into the interproximal area. Once there, she will use vertical strokes to remove the calculus deposits. Once they have been removed, the clinician will return to the distal facial line angle and will begin using light oblique strokes across the facial surface of the tooth. The clinician will make her way towards the mesial facial line angle. Once she is there, she will rotate the toe third towards the mesial surface and she will perform vertical strokes to remove the calculus deposits. The clinician will perform the same technique for the remaining posterior teeth. Once the clinician feels confident that she has successfully performed debridement on the necessary tooth surfaces, She will follow with her 1112 Explorer to ensure that all deposits have been removed. The clinician will use an exploratory stroke for this method. Right now, the clinician is seated at 8 o'clock for the surfaces towards her. Now, the clinician will move to 11 o'clock for the surfaces away from her.